Welcome to Noon Wednesday. I'm Marissa Wojcik, multimedia journalist with Here and Now on PBS Wisconsin. Today is April 7. Last week, the Wisconsin Supreme Court ruled that Governor Tony Evers was in violation of state law, issuing extensions of statewide public health emergency orders. And consequently, the state is no longer eligible to receive nearly $69 million in food emergency benefits from the federal government. So joining us today to talk about what this means and what might be done is Matt King. He is the Associate Director of Hunger Task Force. And Matt, thank you so much for joining us. I want to start by asking you said the need for food assistance is at unprecedented levels. So what are you seeing day in and day out as you're helping Wisconsinites secure food?
Thank you for having me. It's been a tough year for everyone, no matter what your circumstance is. Unemployment across Wisconsin has increased by 41% over the past year. So from 3.4% to 4.8%. And alongside of that, we've seen a huge increase in need for food assistance. So in a typical month, we would serve 50,000 people through our charitable network, half of those being kids, 10,000 low-income seniors. And so need across the state has mirrored that at a really high level.
And are these very low-income folks, or are these people who are just hitting hard times because of the pandemic? What does this demographic look like?
It's across the board, but it's people who have lost jobs as a result of the pandemic, people who have not had to seek assistance before, and so it's been really tough for a lot of people to be able to go out and ask for help for the first time.
And so if this $69 million per month is no longer available to the state, how many households and how many people across Wisconsin would be impacted?
Right. So one of the most effective tools that we have in fighting hunger is the Supplemental Nutrition Assistance Program, or SNAP, which in Wisconsin is known as Food Share. So over 407,000 households are currently enrolled in the program in the state of Wisconsin. And that equates to over 770,000 individuals. So there's 407,000 households that are currently enrolled in the program who have been able to have an increase as a result of the public health emergency, have been able to receive an increase in the amount of SNAP that they're receiving.
And as you said, because of the public health emergency, so to be clear, this isn't normal food share. This is specifically because of the pandemic, right?
That's right. So in the month of March, because of the pandemic, this emergency food share was $55.6 million coming into Wisconsin. On April 1st, the USDA approved an additional benefit. And so that is an additional $13.4 million. So $69 million a month in emergency food share is now at stake. And without a public health emergency declaration in Wisconsin, we are not able to access those funds and will miss out on that $69 million a month in additional funds to help poor folks in Wisconsin.
So if we were to break this down a little bit, what does that look like for an individual person?
Sure. As an example, a senior who is living in subsidized housing, so poor seniors in our community, pre-pandemic, they would have received $16 a month in food share. Now, as a result of emergency food share and this additional allotment and the increase, they're receiving $234 a month. So going from $16 a month in assistance to $234 a month in assistance, as an example. So that's an increase in funding that makes it possible for that senior to not have to visit a food pantry, but rather to go to the store and buy their groceries. And the point being that these are 100% federal benefits that aid our food economy. So these are funds that are helping growers, farmers, food producers, grocers, truckers. So this is money that's coming into our state economy during this difficult time, creating and sustaining jobs.
And so what are Wisconsin's options to reinstate this funding if this emergency order that originally came from the governor is no longer a possibility?
Right. So this is not an issue that Wisconsin is alone in. As emergency declarations expire, there's going to be additional states that are encountering this issue. So we are looking currently at Michigan, where the Department of Health Services in the state of Michigan made a declaration of the emergency that allowed them to continue to access those resources. So it does not take the governor or the legislature to create a state of emergency or a public health emergency to be eligible for the federal aid. If we had a declaration of the public health emergency issued by the Wisconsin Department of Health, then we would be able to continue to access these resources and help people in need.
Part of Republican or the Republican-controlled legislature criticism is that they already put a bill forth that the governor vetoed that reinstated some of that emergency order language that would have kept that funding going. Is it also a possibility that the legislature could be the ones to reinstate that funding through some sort of bill or legislation?
Certainly. This issue does not have to be a partisan issue. Feeding hungry kids in the state of Wisconsin does not need to be a partisan issue. So we're looking to our leaders to come forward with the solution to make this happen.
Given that Republicans in Wisconsin have somewhat wanted to narrow down the food share program, for example, under former Governor Scott Walker, there were stricter food share benefits that were narrowed by work requirements. So given that, is it a different landscape now that we're in a pandemic, that Republicans are open to receiving these federal dollars for food assistance?
Yeah, well, the pandemic has brought a lot of people closer to the issue and the struggle. And so there has been an increased dialogue around the value of this programming to the food economy. So this is also a benefit for farmers, for growers, for grocers. This is an economic stimulus, not just food aid for poor people. And so I think the last year has really reinvigorated that dialogue and that realization that this is a program that is multifaceted and has many benefits. So as we have continued to see this increase in participation in the program, at the same time, there's been flattening of demand for food from charity, meaning that the SNAP program works as a front line of defense. And so the safety net for people who are falling on hard times really is set up in such a way that the food pantry is a place where people can go in an emergency, but the SNAP program is what helps them as they transition back towards employment.
So you're saying by people being able to spend more money directly on groceries, because the SNAP program has been expanded under this emergency order, there is less of a strain on emergency food pantries and other emergency food services.
That's right. And with the dramatic increase in unemployment and the increase in need, the emergency food system of food pantries it's not set up to sustain that kind of increase in need. And so the SNAP program has been absolutely critical in ensuring that people do have enough resources to make it through this tough time.
Now, is Food Share the only piece, or SNAP benefits, are they the only piece of this puzzle?
Certainly not. So there are other federal nutrition programs through the USDA. There's the Emergency Food Assistance Program, which also is a big source of food for the food pantry network. And there are other programs such as Pandemic EBT, which for families who are on free and reduced price lunches, so families who depend upon school meals to feed their kids, but have not been able to because schools have been virtual. There's a program in place to take some of that funding and transfer it directly to families to help them to feed their kids.
So with all those programs, how important is Food Share or SNAP benefits in the big picture?
Well, I think that this year we're going to take a lot of lessons from our response to the pandemic and in some of the changes to these programs and how effective they've been. So I think that as the federal government approaches things like child nutrition reauthorization, that these are lessons that we're going to have to take to that discussion to help make more long-standing changes within these programs and make them more effective in the longer term.
So given what we know about how it has eased some strain on food pantries, how, as you have talked about, it helps farmers and the larger food economy in the state, what do you see as a possibility for this kind of food assistance at this funding level being sustained after the pandemic, even farther out?
Yeah, I look forward to those conversations. It has been the most critical tool in fighting hunger and helping families who have fallen on rough times. And as I mentioned, seniors and children. So for the most vulnerable in our community, these are absolutely critical programs that we have to commit to moving forward.
Do you think Wisconsin officials, whether it's from the Department of Health Services or the legislature, will find a way to reinstate these SNAP benefits and food share dollars?
I do. As I mentioned, it does not take the governor or the legislature to create a state of emergency or public health emergency to be eligible for this federal aid. So a simple public health emergency issued by the Wisconsin Department of Health would go a long way, and that doesn't have to be binding, on certain, behaviors, but that can really just in cooperation, the state of Wisconsin and the USDA can work together to make sure that poor people in Wisconsin have the resources that they need.
All right, Matt King from the Hunger Task Force, thank you so much for joining us.
Thanks for having me. Appreciate it.
For more from Here and Now and PBS Wisconsin, you can visit pbswisconsin.org. And thank you so much for joining us on Noon Wednesday.